I can't even tell you how awful that felt like to be as ill as I was and to not be heard. And the other thing is like, at that point, it wasn't even just the doctors, but it was like family and friends and my coworkers. Everybody was treating me like, I felt like people were treating me like I was crazy.
There was a lot of confusion. I'd say a lot of anger as well, some sadness. So over the course of 13 months, I lost about 49 pounds. I had 3 different biopsies, 2 different bone marrow biopsies. I had all types of ailments and infections or illnesses along the way that caused me pretty uncomfortable pains. And it was a long journey. And to be told that we don't know, or we're not sure, or to get placed on the back burner, it was extremely difficult.
I actually said to my doctor, I told you so. I was just like, I told you guys. I told you guys. I told my husband, I was like, I told you so. I told you so. But then I was like, oh my God, I was right. And I was like, wait a minute, I wish I was wrong.
I think gaslighting is really thrown around. It's a very popular term right now. The term gaslighting is based actually on a movie, an old movie called Gaslight, where the husband in the movie made the wife question her version of reality. And it was this intentional manipulation so that she couldn't trust her own judgment. And so that's what gaslighting is. And the medical gaslighting, I wouldn't put so much intent behind it. I think I'd say that it is a minimization or a dismissal of people's concerns. I think there are a lot of different contributors to it, but that's kind of the general gist of it. It's just a dismissal or minimization of what someone's saying that they're having an experience with in a medical context. And so one of the things that is fairly common is that women and people of color are more likely to experience medical gaslighting. And in part, that's because in our culture, there are narratives around how women present with pain, how people of color present with pain. And for example, women might be more anxious and they're saying they're in pain, but actually maybe it's anxiety and it's not actually pain. And there is a really horrible stereotype that is pretty common even recently for people to believe that people of color have a higher pain threshold than white people. And so even if someone's not consciously aware that that's what they're reacting to, that's one of the shortcuts that might show up when someone's talking about a symptom that they have. There was a study that I cited in my blog post, and I can't remember when it was, but it was when, if I remember correctly, it was in the last 10 years where they were surveying physicians about these types of beliefs. And a really disturbing percentage of people responded that they believe that to be true, that people of color have a higher pain threshold, and therefore, then their pain isn't treated adequately. And so I think being aware of the possibility for bias, instead of maybe telling yourself, like, I treat all patients the same. I would never be somebody who would act in that way. It's not conscious. It's sort of unconscious biases that we all hold. Slowing down and listening is so important. And, not needing to know the answer right then, but being willing to work on finding an answer. And also I think just being aware that these bias shortcuts that we take, it's a human nature thing. And the more that you're aware of it, the more that you can see it in real time. So knowing that, how can I check myself and make sure that I'm not reacting in these ways, and instead actually giving full time and need for every person that's in front of you? I really believe that people have wisdom about their bodies, and if something could be caused by anxiety, that doesn't mean that it shouldn't be followed up on. So even if you are anxious about a health complaint, that doesn't mean that it doesn't exist or that it's something to dismiss. And so I would absolutely say just you know your body. And so if you have a concern that something is wrong, be persistent. And that can be really hard, especially with things that we're worried about. So if I'm worried that I might have cancer and my doctor tells me, no, everything's fine, it's really attractive to be like, oh, okay. Yeah, nothing to worry about, because that's what we want to hear. But if you keep tuning in and something just doesn't feel quite right, then it's okay to go to somebody else or to go back and insist on doing whatever follow-up is needed to rule things out. I think that can be really hard, both again, because we want to hear that there's nothing wrong, but also because of the power differential in the physician-patient relationship. When a doctor is saying, no, there's nothing to worry about, and you're kind of getting on my nerves that you keep bringing this up, or you're just anxious, then it's really hard to continue to advocate for yourself in that situation, because it feels like, oh, well, they must know best and I'm just causing trouble. But when it comes to your health, there's no amount of trouble that you can cause that's not going to be worthwhile. I think that is a really common thing that I hear is, you're too young to have cancer. You're too young to have this kind of pain. You're too young to have these kinds of problems. It must be anxiety, or it must be X, Y, or Z thing. Or if, just change your diet, or you need to exercise, or, I think anytime it's attributed to something that's, that's just very patently wrong. People can get cancer at all ages. People can be in pain at all ages. And so I think that's probably a big sign. I think also, I kind of wrap those two things into one, but also being told that it's just anxiety, or some, you're too preoccupied with it, or some other kind of mental health condition. You can't separate things like that. That if somebody is having a symptom that is medically concerning to them, of course they're going to be anxious about it. And it is true that anxiety can exacerbate symptoms, or, kind of mask what is really going on. But that doesn't mean, again, that it shouldn't be followed up on, because we also know that there are medical conditions that can cause symptoms that look like mental health concerns. Like, for example, if our thyroid is out of whack, that can look like depression. And just telling someone, oh, well, you're just depressed. Oh, maybe you also have some life circumstances going on that, and just dismissing it as depression. Well, it could be that, or it could be something that needs follow-up. It's perfectly okay for you to say, okay, if you're not going to follow up on this, then I would like you to document that in my medical record. This is something that's perfectly reasonable to do, is to ask that to be documented in your medical record, that you expressed a symptom, and the doctor is saying that they're not going to follow up on it because they believe it to be due to weight or X, Y, or Z reason. And that sort of puts some leverage back in the patient's hands, that doctors don't want to be sued. They don't want some kind of negative consequence of them not acting. And so it may cue that. And I don't think it's a threat. I think it's a reasonable request to have anything that is not being followed up on and you disagree, to ask that to be documented. And most places now are required to have the electronic medical record. Big enough practices are, and so that you can look at your notes and then you can know whether or not that's been added. If it hasn't, I think you can also document that and, write in your patient mind chart or whatever system you have and say, I asked this to be documented. It was not. I see that it was not, and I'm requesting that it be included. You can also contact the medical records office of whatever facility it is and ask for an amendment to your medical record. So there are lots of different things that you actually have more control over than you realize you do, because people aren't aware that these are requests that they can make. And in any case, even if it's not included in the medical record, if you have documented it written by sending that to your physician, then you have some information on your side. But I think if you're needing to go to those lengths, then it's probably time to get a second or a third opinion, really. So yeah, when I've been in those positions, like I literally feel anxiety in my stomach. I'm a recovering people pleaser. And so I very much feel that, like, I want to be the good patient. I want them to like me. I don't want to cause conflict. But when it comes down to it, if it's really like your life, or whether this person is happy with you, it has to be your life. It has to be your life or your quality of life. That has to be what wins. I think probably, particularly for people who are dealing with chronic issues, to keep really almost like a diary of how they're feeling, so that you have that data to look back on. Keep track of symptoms. And that could be duration, intensity, frequency of symptoms. And that way you have that data to provide the physician so they also know what has changed since the last time you came to them. It can also be really helpful with starting new medication. So you can kind of suss out, is this a side effect and is this going to get better? Or is this a new symptom? And it can be hard to tell. I think one of the things that I've noticed that's really tough with people that deal with chronic issues too is that a lot of times they're invisible. And I think that just my observation is it's really much more difficult for other people to understand invisible symptoms like pain or insomnia or if it's not something that you can see, it's easier to dismiss. And that can go from loved ones, and they can have the best intentions, but you just can't see debilitating pain unless it's affecting the way that you move and what you can do day to day, to physicians as well. They're just as human as the rest of us. And it can be hard to really quantify some of those invisible things. Yeah, I think one of the things that I've observed about the culture of medicine in the United States is that there isn't a lot of compassion for the providers themselves. And so even in the education, going through that period of time, you're not allowed to be wrong. You've got to make sure that you are doing everything perfectly. And so acknowledging that you might make a mistake or that you don't know something is really heavily frowned upon. And so when you carry that into medical practice, it looks like not just acknowledging that those things are bound to happen. And so because they do, how can we, instead of, being horrible to ourselves when we make mistakes, or maybe doubling down and not acknowledging them, which is a different kind of problem, just saying, okay, I'm human and I'm going to make mistakes. And because of that, I have a little bit more permission to be kind to myself when that does happen, and just be monitoring for it instead of feeling like, well, I can't, it's not allowed. And it's not going to happen because it's not allowed to happen. And so I think just, a big thing to me about self-compassion is a common humanity. That's some kind of a foundational component of self-compassion, and that we are just all acknowledging that we are human. And because of that, we all share challenges and experiences that we often feel like we're walking with alone. And I really feel like the more that these things are voiced, the easier it is for everyone to just slow down and be kind to one another, because we're all suffering. That's part of being human. It happens on the patient side just as much as it does on the physician side, is that we all kind of filter things in through our assumptions and our expectations and the predictions that we're making. And so if you go in thinking, this person's not going to be helpful to me and they're just going to dismiss me, then it may be harder to hear what they have to say. And so if it's possible to put the defenses down and just say, okay, let's see what happens. And then I can take steps from there if it doesn't go the way that I would hope it to. And that might mean, again, I'm a huge fan of people finding other physicians if they don't feel supported and don't, because there's no point. If you don't have a doctor you can trust, I really feel like that's a foundational component of healthcare. And if you don't have that, then you need to find a way to at least get as close to that as you can. So at least even just like a workable relationship, even if it can't be a trusting. I know I've talked to people who, I work in cancer, so that's most of what I see. Their oncologist isn't the warm and fuzzy type, and they're okay with it. And they're like, okay, as long as they can answer my questions, and as long as they take me seriously, that's fine. And then I have other people say, like, no way, this is horrific, and I'm terrified, and I need warm and fuzzy, and that's okay too. And so just knowing what are you looking for, what is it that you need from this relationship, and it's okay to keep looking until you find that. There are good doctors out there. I know there are. I've had them. So even if you have had a really bad experience, recognizing when that protection of being defensive or not trusting may actually be causing harm in the long run, and seeing if you can work on, letting it down a little bit. Just like if you got robbed, you would probably lock your doors and make sure that you're doing sensible, things to make sure that you are protected, maybe getting on those Ring cameras and those kinds of things. But if you're staying up all night with a baseball bat waiting at the front door, that's no longer helpful, right? And so it's just all about helpful versus harmful, and trying to find that balance. And I think the other thing I want to make sure that people hear is that this doesn't just happen to women and people of color. It happens to everyone. It's just more likely to happen to those populations, or for people who have certain disabilities, people who have certain chronic health issues, people who have difficulties with their weight. These are all sort of more vulnerable to medical gaslighting, but it can happen to anybody. It can happen to the most well-educated white male person that there is. It just can. I think that the more people that you can say, I have this concern, do you have any advice on what I should do? What are the next steps here? And those are the kinds of questions that I get a lot, that I think people don't realize that there are a lot more things that you can do than you think of. And so for people like people who work in the healthcare system, they may know the next best step. So for example, I've been in a situation where I've needed to contact like a practice manager of a clinic and make a complaint about something. A lot of people don't even know what a practice manager is and what they can do for you. And so if you're kind of using the people in the healthcare system as your allies, they know all that language and they know the sort of the next best appropriate step. So even if they can't do something for you in that specific situation, they know who has more leverage maybe than they even have, and they can take that next step. And I've counseled people and like even gone like, what's the big picture here? Okay, the State Hospital Association, let's contact them and let them know what your concerns, or the medical licensing board. Like there are a lot more things that are available that may at least maybe be a learning experience for a physician, even if it doesn't change the actual outcome with that particular person, but avenues to be able to really insist on your rights. And those are rights. Patients have rights in each state about what they can demand, essentially. And I think it's also important that people know that too. All of these things are easier said than done. I recognize that. I don't think it's fair that patients should have to do these things, like insist on, they shouldn't have to insist so hard. And yet sometimes you have to. And so looking at it from what you can control versus what you can't control, instead of how things should be, can be useful. I don't want anybody to get the message that somehow they're doing something wrong if they're struggling with this, or if they don't have the energy to be able to change their behavior in a healthcare setting. But at the same time, this is a reality that is not going to quickly change. And so focusing on what you can control and doing the best you can with that. I'm not saying that it's right or that it should be this way, and it shouldn't. It's just that there's only so many things that we can do in this scenario. One of those things is being an advocate for ourselves.